Hello and welcome. My name is Ryan Peterson. I am a LMRT here at Texas Children's Urgent Care here in Austin, Texas. Um, just going to give a quick proposal on why I believe that the importance of pediatric dose limits in patient education is important, and how we can go in the future with handouts and have them understanding why it is so important to correctly dose your sick infant, child, toddler, whoever it may be. So just to start off, importance of pediatric dose limits in parent education. The importance of medication limit dose education could be the life and death of your child. As a medical care provider, it is our duty, our job to educate these parents that their child may fall under different guidelines when it comes to medication dosing. It's not always by the age, but it's also by their weight, So education is always a good thing for these parents. The handouts that I propose to educate the parents is simple guide to how correctly measure child's medication dose. The handout will have instructions to verify the weight, how to correctly use your syringe when dosing the child, and also gives you information for the right amount and how to correctly measure accuracy of that medication. All right, so if you do come to a point in the time that you are not educated or you need a backup plan to look at, I found a beautiful website. It's really, really good. www.hobeichpediatrics.com/handouts. And this website is made by a doctor, which is Dr. George Ochbich, and he has handouts that are in English and in Spanish. How to give your baby infants Tylenol. It goes from talking to the doctor, right amount. Also giving your child pain relievers, which also goes into preventing colds and the flu for your infant and your child. Okay, so just to give you a little rundown on the handout that these patients would be receiving once leaving the clinic for their education. How to give your baby infants Tylenol. So first off, always step one, ask your doctor. You always want to ask the doctor to make sure that you are in the correct reasoning for giving Tylenol. Always measure the right amount. With this handout, it also shows you here how to pull and place your medication into your child's mouth. Then step three, giving the medicine. It gives you great information on step-by-step process on how to administer the medicine. Also, the handout that I have is giving your child pain relievers. So it always starts with know the proper dose. Okay, you can't do anything if you don't know the proper dose of what you're giving to your child. You never want to give them too much; that can always harm them. And also, you never want to give them too little because it's not doing the right effect. So definitely want to know your dose. And you definitely want to know the accuracy of what you're giving. And also, another thing is don't give the medication that you're giving too soon. That can also go into overdosing as well. So the education that you would be receiving, that these patients would be receiving, is very, very informative information that I believe is key to helping these patients' caregivers give them the right dosing to the child before coming into clinic. Also, another website that I found is www.urgentcare.texaschildren's.org, which gives them a breakdown in where their child lays as far as weight, because we always want to look at the weight, not the age of the child, So that also gives them the information. So I believe these handouts are very informational. They can always be obtained through a website, but I feel for the sake of the patients that we care for, that with giving this information to them as they're in the clinic can be the start of something great and the start of something that helps the child out. So I really believe that the proposal that I'm giving is very beneficial to the company and also beneficial to the healthcare. Just having them start the right preparation to getting their child better is always a great thing. So I just wanted y'all to give this a chance. Read over the information, listen to the information that I provided, and just really sit down and think about it. Thank you.